Behavioral activation therapy, BAT, is a therapeutic intervention primarily used to treat depression. It is grounded in the principle that engaging in rewarding activities and reducing avoidance behaviors can improve mood and reduce depressive symptoms. BAT is a subset of cognitive behavioral therapy, CBT, but places a more significant emphasis on action and behavior change rather than on changing thought patterns. Historical and theoretical background. Origins in behaviorism. BAT has its roots in behaviorism, particularly the work of B.F. Skinner. It evolved from the traditional behavioral component of CBT, focusing on the relationship between activities, mood, and depression. Development and recognition. BAT gained prominence in the 1990s and early 2000s, as research began to show its effectiveness in treating depression. It was particularly noted for its simplicity and practicality, compared to more complex cognitive interventions. Core principles of behavioral activation therapy. Activity monitoring and scheduling. One of the central components of BAT is monitoring one's daily activities to identify those that contribute to a positive mood and those that lead to feelings of depression. Clients are then encouraged to schedule more rewarding activities and reduce avoidance behaviors. Focus on action. Unlike traditional CBT, which focuses on altering thought patterns, BAT emphasizes action. It operates on the idea that changing behaviors can lead to changes in thoughts and emotions. Role of avoidance and activation. BAT identifies avoidance behaviors that contribute to depression and works on developing activation strategies to engage more in life-enhancing activities. Techniques and methodologies. Functional analysis of behavior. Therapists help clients understand the function of their behaviors, particularly how certain actions may be maintaining their depression. Gradual increase in activity levels. Clients are encouraged to gradually increase their involvement in positive and rewarding activities, starting with small, manageable tasks, and progressively taking on more challenging ones. Problem-solving techniques. Clients learn problem-solving skills to overcome obstacles that prevent them from engaging in rewarding activities. Application and effectiveness. Treating depression. BAT has been proven effective in treating a range of depressive disorders, from mild to severe. It is especially useful for individuals who may not respond well to more traditional cognitively focused therapies. Adaptability. BAT can be adapted for different age groups, including adolescents and the elderly, and can be used in individual or group therapy settings. Empirical support. Numerous studies support BAT's effectiveness, noting improvements in mood, increased engagement in life, and reduced depressive symptoms. Challenges and considerations. Motivation and engagement. One of the challenges in BAT is the initial lack of motivation that many depressed individuals experience. Overcoming this inertia is a critical first step. Individual tailoring. Activities must be tailored to each individual's interests, abilities, and circumstances. What is rewarding for one person may not be for another. Comorbidity considerations. For individuals with comorbid conditions, e.g., anxiety, substance abuse, additional treatment strategies may need to be integrated. Future directions. Broader application. Exploring the application of BAT for other disorders, such as anxiety or PTSD, could broaden its utility. Technology integration. Incorporating digital tools, such as apps for activity monitoring and scheduling, can enhance the accessibility and effectiveness of BAT. Combination with other therapies. Investigating how BAT can be effectively combined with other therapeutic approaches, such as mindfulness or pharmacotherapy, could provide more comprehensive treatment options. Personal perspective. Behavioral activation therapy represents a pragmatic and accessible approach to managing depression. Its emphasis on action over introspection appeals to those who might feel overwhelmed by the prospect of delving into cognitive processes. The simplicity and focus on concrete activities provide a clear pathway for individuals to begin taking steps towards recovery. As mental health treatment continues to evolve, BAT stands out for its potential to empower individuals, fostering a sense of agency and accomplishment in their journey toward mental wellness. Integration with lifestyle changes. Behavioral activation therapy not only focuses on psychological interventions, but also encourages integrating positive lifestyle changes. These changes can reinforce the benefits of therapy and contribute to overall well-being. Physical activity. Regular physical exercise can be a key component in BAT, as it is known to reduce symptoms of depression and improve mood. Social engagement. Encouraging social interactions and participation in community activities can combat isolation and provide a sense of belonging and support. Healthy routine development. Establishing a healthy daily routine, including adequate sleep, balanced nutrition, and time management, can enhance the effectiveness of BAT. Collaboration with other health professionals. In the management of depression, collaboration with other health professionals can be beneficial. This multidisciplinary approach can address various aspects of an individual's health. Working with primary care physicians. Coordination with primary care providers can ensure a comprehensive treatment plan, especially for individuals with physical health issues that may impact their mental health. Consulting nutritionists or dietitians. Dietary changes can have a significant impact on mental health. Consulting nutritionists can help in creating diet plans that boost mood and energy levels. Referral to physical therapists or personal trainers. For clients who need structured physical activity, referrals to physical therapists or personal trainers can be advantageous. Cultural and individual considerations. It's important to tailor BAT to the cultural background and individual preferences of each client to ensure its relevance and effectiveness. Cultural sensitivity. Understanding and respecting the cultural context of clients can help in selecting activities that are culturally appropriate and meaningful. Personalization of activities. Activities should align with the client's interests and values. Personalization makes the therapy more engaging and sustainable. Research and training in BAT. Further research and training are crucial for the continued development and effectiveness of behavioral activation therapy. Longitudinal studies. Long-term studies can provide more information on the lasting effects of BAT and its impact on preventing relapse. Training for therapists. Comprehensive training for therapists in BAT can ensure that they are well equipped to implement this therapy effectively. Public awareness campaigns. Increasing public awareness about BAT can help in destigmatizing depression and encouraging individuals to seek treatment. Challenges in implementation. Despite its effectiveness, there are several challenges in implementing BAT. Resource availability. In some regions, there may be a lack of resources, such as accessible mental health professionals trained in BAT or community activities that can be used as part of the therapy. Client resistance. Initial resistance, especially in clients with severe depression, can be a barrier. Overcoming this requires patience and skill on the part of the therapist. Monitoring progress. Continuously monitoring and adjusting the therapy based on the client's progress is essential, but can be resource-intensive. Personal insight. Behavioral activation therapy is a testament to the power of simple, actionable steps in the treatment of depression. Its focus on doing rather than just thinking or talking about change is a practical approach that empowers clients. The therapy's adaptability to individual needs and its ability to incorporate lifestyle changes make it a versatile tool in mental health care. However, the success of BAT hinges on the client's participation and commitment, as well as the therapist's skill in guiding and motivating the client. As research and practice in this area continue to grow, BAT's potential to provide relief and improvement in the quality of life for those with depression is increasingly promising. The challenge remains in making this therapy accessible and tailored to meet the diverse needs of individuals suffering from depression. House of Thought Therapy. Nurturing minds, empowering lives.